Well, good afternoon, everyone. Let me first of all thank you for being with us. Honored to be joined by our First Lady Marty Kemp today, certainly Dr. Toomey, and Department of Community Health Commissioner Kaylee Noggles also with us today. Let me just start with a few things here. First of all, I want to continue to encourage unvaccinated Georgians to talk to their medical professionals or those that they trust and consider doing so. This safe, effective vaccine reduces the likelihood you will get infected with COVID-19, but more importantly, it drastically will reduce the chances of you ending up in a hospital bed or losing your life. In fact, during my call with the Metro Atlanta Hospital CEOs last week, they reiterated on the call that well over 90% of all Georgians currently hospitalized with COVID-19 are unvaccinated. That's why I've written again to the FDA to encourage them to grant full approval to the vaccines in order to address hesitancy among many Georgians who haven't gotten their first shot yet. 168 million Americans have already been fully vaccinated, and thankfully our numbers continue to rise here in Georgia. But one of the things that we continue to hear from those who haven't been vaccinated is the EUA status of the vaccines. I'm hoping that the FDA will act soon and we can continue the great efforts that state, local, and nonprofit and private sector leaders have made to get more shots and arms. As I've mentioned last week, I held another routine call with CEOs from the Metro Atlanta area where they provided a status update on their ongoing efforts to fight COVID-19, but also care for other pressing health care needs of the people in their communities. I'll also add that my office has been in contact with many of the rural hospital leadership teams over the weekend and yesterday or prior to the weekend, into last week, and also today through communities throughout our state. Virtually every hospital's most pressing issue is a lack of qualified staff to treat the patients coming through their doors. Nurses, respiratory therapists, ICU personnel, just to name a few. Through October of this year, the state, coordinated through the Department of Community Health, has already committed $500 million to provide 1,300 staff on an ongoing basis to 68 hospitals across our state. To expand those efforts, I'm announcing today that Commissioner Noggle and her team will increase the total number of state-supported hospital staff from 1,300 to 2,800, more than doubling our staffing assistance to date. This would amount to an additional $125 million of investment in state-supported staffing of hospital systems in both metro and rural areas through the first week of December. Specifically, 170 of these new staff will go directly to rural hospitals. Commissioner Noggle and her team will have also identified 450 beds in 9 regional coordinating hospitals that will soon be available to treat patients statewide thanks to this additional staff. As we move forward, my team and I will continue to monitor the situation in our hospitals to ensure that Georgians who need access to care can receive it. Also, to encourage more state employees to get vaccinated, today I'm also announcing that state offices will be closed Friday, September 3rd, in advance of Labor Day weekend. I'm asking all state employees who have not yet gotten their shot to consider scheduling it on or before Friday, September the 3rd. For those of you that have been vaccinated or got their shot before September 3rd, please take this day off as a thank you for all the work that you have done and for stepping up to help protect yourselves and protect others from you during this pandemic. And enjoy this time with your friends and family. We certainly are appreciative of all that our state employees have done over the last year and a half, going on 2 years now, working through a global pandemic and keeping our state running. Finally, today I want to reiterate that Georgia will remain open for business. We will not shut down. We will not prevent families from earning a paycheck. Georgians know the risk of this virus, and they know we have the tools at our disposal to prevent serious illness, hospitalization, and death. The most important thing for Georgians to do at this point, if you're not vaccinated, is to please talk to your doctor or medical professional or someone that you trust that perhaps has been vaccinated, and make a good health care decision for you and your family. As you all know, our 3 daughters have been vaccinated, and Marty and I have as well as our parents. As I've said for the last year and a half, I'm again asking Georgians to be part of the solution to this virus. Again, thank you all for being here, and I'll turn it over to Dr. Toomey, and then we'll take some of your questions. Thank you. Dr.